Good afternoon, everyone. This week is an exciting week. It's our first Ohio Vax-a-million winner will be announced on Wednesday night, 7/29, during the evening Ohio Lottery broadcast. The Ohio Lottery has conducted a data integrity review of registrations. Registrations closed at midnight last night. This review included removal of duplicate entries. I'm pleased to announce that 2,758,470 Ohioans have registered for the $1 million drawing. And again, a reminder, once you're registered, you're in for all 5 drawings through the next few weeks. So again, that number is 2,758,470 Ohioans are in and registered. Also, 104,386 young Ohioans registered for the scholarship drawing. Again, that's our young Ohioans, 104,386 people registered. Overall, as of this morning, we've had 74 million page views on our registration page at ohiovax-a-million.com. And finally, the amount of earned media that we have received in stories just for the first week, for the first 7 days, comes up to $15 million. $15 million of free earned media in regard to Vax-a-million. And again, remember that you can still register for the subsequent 4 remaining drawings. You can register right now by visiting ohiovax-a-million.com. That's ohiovax-a-million.com. If you do not have internet access, you can also call 1-833-4-ASK-ODH. That's 1-833-4-ASK-ODH to register by telephone. If you do have internet access, registration online at vax-a-million.com is preferred and is the fastest option to register with the exact same odds of winning. However you get in, you are in. I've asked our data team to kind of drill down on where we're seeing the increases since we had announced the Vax-a-million. And as we've talked about, have seen significant increases. I'm very, very happy about that. That's what we hope we would see. But just kind of break it down. The group that has registered much faster, where we've seen the biggest increase, is those 16 and 17 years of age. Very, very interesting. One assumes that they're very interested in getting that scholarship. They're looking at college coming up, and they're looking to see if they can get in and win that. That group, the 16 to 17-year-olds, there's been a 94% increase in vaccinations. Among the ages 18 and 19, we've seen a 46% increase, and ages 20 to 49, we've seen a 55% increase in vaccinations. I've also asked our team to look at where we've seen the most increases by county. And the following are the top 10 counties where we've seen the most increase. Again, interesting. Athens County leads at 144% increase. Harrison County is second, 143% increase. Morgan County, 138% increase. Seneca County, 138% increase. Wyandotte, 129% increase. Miami County, 129% increase. Gallia County, 119% increase. Lawrence County, 113% increase. Fayette County, 113% increase. And finally, rounding out the top 10, Ross County with 107% increase. We have seen increases really across all demographic groups, and that's a very, very good thing. So that is great news. Let me talk about some other good news. Today we saw the approval of 9 projects that are set to create over 3,000 new jobs and retain over 4,500 jobs statewide. One of the projects is Peloton Interactive, which will create more than 2,000 jobs in a new manufacturing facility in Wood County. This is their first in the United States. They hope to break ground later this summer. So that's very, very good news. Ohio continues to have a strong pipeline of projects that will create jobs for Ohioans and support our post-pandemic recovery. We appreciate the work of Jobs Ohio, as well as our Development Service Agency, to support business growth in the state of Ohio. Eric, let's go and let's take a look at some of our data slides. Our key indicators, you'll see on the key indicators, cases down. We're looking at this number. Love to see it go below 1,000. That's the 21-day average per day. So we're trending certainly in the right direction. Eric, the next one. This is the number we continue to look at. If you recall, some time ago, we said 50 cases per 100,000 for a 2-week period statewide was where we wanted to get to. We have seen a continuous decrease. We're now going down about 2 a day, to somewhere between 1.5 to 3 a day. We're going down. We're at 89. So as you can see, we've got about 39.8%, almost 40%, or 40 to go, or cases, excuse me, not percent, but cases to go. So we're moving in the right direction in regard to that. Eric, this is hospitalizations. Our hospitalizations, last reported number of Ohioans in the hospital for COVID is 767. 767. So that is obviously a number that's been coming down. We're very happy about that as well. Any other numbers there, Eric? Okay. As we continue to look at the numbers of vaccinations being administered across Ohio, we know that Ohio Medicaid beneficiaries have a lower uptake than their fellow citizens in Ohio, and it's appreciable difference, 42% compared to about 45%. So, excuse me, 22% compared to approximately 45%. So 22% Medicaid, that obviously is not a number that we're happy with. Is much, much too low. And earlier this month, we challenged our managed care plans to do much more in this area. Our managed care plans are those who are delivering, seeing that the services are delivered in regard to medical care. We must get these numbers up. They're simply unacceptable. The managed care companies are now implementing a game plan to do just that. And these are some of the things that they are doing. Partnering directly with pharmacies, they're providing incentives such as gift cards to people on Medicaid who get vaccines in pharmacies. They're incentivizing pharmacists to counsel people picking up prescriptions about their vaccinations. That latter point is very, very important. Having the pharmacists spend time with that individual and talking and counseling them in regard to the vaccinations. Next, working with local health departments, community providers, faith-based efforts to help get the word out about vaccination events to people on Medicaid. Where is the vaccination occurring? Where are these events taking place? Managed care is also providing staff to help run the events when needed and providing transportation to make sure people can get to and from the vaccination locations. Finally, tailoring strategies to meet people where they are. Certainly something that we've been trying to do throughout this. This is a special effort in regard to people who are on Medicaid. They've identified individuals, the managed care has identified individuals who can't leave their homes and are working with providers who can go directly to them with shots. They're also working with providers to help them create vaccine opportunities outside of normal business hours. These major efforts show promise, we believe. We're hopeful that this will bring about an increase in vaccinations among those people who are on Medicaid. So a high priority, something that we have challenged the managed care companies to do. Again, getting people vaccinated is how we get out of this pandemic. On the phone this morning with our local health departments, they brought up an issue of a discussion that some of them have been having with our local school districts. And as everyone knows, on June 2nd, the health orders, with the exception of our nursing homes and assisted living, our health orders basically go away. So the question, they've raised a question though in regard to quarantining. I want to take a minute to clarify some information about this. When dealing with deadly communicable diseases, isolation and quarantine of unvaccinated people has been used successfully for hundreds, if not thousands of years. It did not start with the pandemic. In the simplest terms, isolation and quarantine will be conducted as they were before COVID-19 and as they were when we had health orders on. Beginning June 2nd, in accordance with CDC guidelines, if a child has not been vaccinated, they should isolate if they test positive for COVID. So in other words, we will continue moving forward in regard to isolation based upon traditional health rules, traditional health best practices. And best practice is probably a better way to describe it. So in accordance with CDC guidance, if a child has not been vaccinated, they should isolate if they test positive for COVID. While this is not a state health order, it is standard infection control practice. Vaccinated children do not have to quarantine or be tested if they are exposed. Let me again say that. Vaccinated children do not have to quarantine or be tested if they're exposed. Unvaccinated children who are close contacts of the positive case should, in fact, quarantine. So unvaccinated children who have a close contact with someone who tests positive should quarantine. Again, while this is not a state health order, it is standard infection control practice. This is in keeping with the best practices, and local health departments should determine if quarantine or isolation should occur, just as they always had throughout history. Isolation, which is what happens when a person is sick, and quarantine. Let me state it again. Isolation, which is what happens when a person is sick, and quarantine are standard public health practices that are implemented for many communicable diseases, including measles and mumps. No change there. Let me talk for a moment, and then I'm going to send it over to Dr. Vanderhoff to talk a little bit more in detail about this. On June 2nd, however, it will be up to the individual school districts as to whether they continue masking and social distancing in school settings. So again, June 2nd, it's up to schools to determine whether they continue to mask, what they do in regard to social distancing. Up to each school. But I can only say that our schools have been phenomenally successful in keeping down spread in the classroom. They have done this by wearing masks. The other thing that we should keep in mind, that as of today, a child 11 years of age and younger cannot be vaccinated. So I would hope that schools, superintendents, school boards will take that into consideration. It's their call what to do in regard to the masking, but this is something that certainly has worked exceedingly well. Dr. Vanderhoff, maybe a little bit about the norm in regard to dealing with communicable diseases, how we normally deal with that, and how we're going to continue to deal with that in regard to COVID.
Sure. Thank you very much, Governor. As you noted, isolation and quarantine have been around a very long time. In fact, you'll find reference to them in the Old Testament, in the Bible. They're widely employed. They're among the most effective public health measures known to humanity. Isolation and quarantine really help protect all of us. They help protect the population, the public. by preventing exposure to people who have or who may have a contagious disease, which, again, as the governor noted, COVID clearly is. Now, just to reiterate, isolation specifically separates sick people from people who aren't sick. So, a very rational thing to do. Quarantine separates people who were exposed to a contagious person to see if they become sick. Now, fortunately, our vaccines are highly effective at protecting people against COVID-19. And so, therefore, fully vaccinated people are unlikely to get or transmit COVID-19 to others. So, generally speaking, vaccinated people, vaccinated children in school with no COVID-like symptoms don't need to quarantine. They don't need to be restricted from work, school, or play. They don't need to be tested following an exposure to somebody. However, unvaccinated people lack this protection. And so the CDC continues to endorse quarantine for people who don't have symptoms but may have had an exposure. And in like terms, they continue to recommend isolation of people who may be sick with COVID-19, people who have actual symptoms of COVID-19. That guidance, that is an approach, isolation and quarantine, which it really just makes common sense. Governor, back to you.
Thank you very much, Lieutenant Governor.
Thank you very much, Governor. I want to amplify something that you said a little earlier. As someone who grew up in Northwest Ohio, I am really excited about the announcement that Peloton is going to make a $400 million investment, creating 2,000 plus jobs in Northwest Ohio and Wood County. I don't think they've disclosed, but I do know that they're very high paying jobs. This is a reshoring of manufacturing win for us in the sense that, Northwest Ohio, great manufacturing state, and we proved once again that we can be the home to a state-of-the-art manufacturing facility and attract this investment. It's especially good news because the states that we were competing against 10 years ago, we were losing jobs to them. Today, we're winning them. And that's great news for all of us. We're back in the competition on that front. And we were doing a lot of things during COVID. In addition to managing the pandemic, we were working with Jobs Ohio to be very aggressive at creating some opportunities for post-pandemic prosperity. And that's exactly what this announcement will be. When we met with Peloton over at the Jobs Ohio offices several months ago, we promised them that we would provide a great business environment and frankly, deliver on the most important deliverables for them, which to them was making sure that we completed construction on time so they could get into production on time and to provide the best educated and trained workforce with that strong Ohio work ethic. And I know that we're going to be able to provide those to Peloton. And in return, what we get from them is a state-of-the-art facility. It will be one of the just coolest manufacturing facilities being built in the country, and thousands of great high-paying jobs for the people of Northwest Ohio. And the net benefit is everybody wins. Peloton's customers, the people of Northwest Ohio, our state, and it's a very exciting announcement. And I say that because it brings me to, again, workforce and job training, which was critical for our ability to land this facility. And we have another round of tech cred opening on starting June 1 through June 30th. We have some funds that we're going to make available for a final round in this fiscal year. Remember that for employers, as you're training people, as long you can train people that you want to bring on your payroll using the tech cred program. That's techcred.ohio.gov. So far, 1,100 businesses have trained, have received 19,841 technology-focused credentials. I was at a business in Northeast Ohio last week where they were, as they had older manufacturing specialists who were leaving the business, they were using it to train the next generation, which is a great idea for what we want to do with it. And Eric, yeah, Eric has the slide up there. That's the number for the tech cred credentials that we've awarded so far. Another round June 1st. Eric, if you could move to the next slide so that people can see the kinds of skills that are most in demand during this process. These are the kinds of certifications that people are seeking. I think they're listed here by the number of money, the amount of money that we've spent on these certificates. They are we know very well that these are the kinds of certificates that businesses are hiring. In many cases, you can complete these in 3 months or less. That is certainly important for people who need to get into the workforce to do this quickly. And Eric, if you could move to the next slide. We also have a program for people who are out of work. This is for people who maybe are working at a different employer, or maybe they're out of work right now. You can use the IMAP program. We are awarding credentials up to $3,000 to help you earn a credential so that you can take one of the many jobs that are creating. If you looked at the latest update on Ohio Means Jobs, there are more than 99,000 jobs that pay $50,000 a year or more. And this is the place that you can go to earn the skills, the certification, credentials that you need to get one of those jobs. It's available for you at no charge, thanks to the generosity of the taxpayers of the state of Ohio. We want to help you get started on these great career opportunities. And we can go to the next slide, and you can see similarly, these are some of the credentials that are often being sought under the IMAP program. They're available. And many of these, I think half of these credentials can be earned 100% online. So you don't have to physically go to a location to earn these credentials. You can work, you can be at work, you can work, and you can do these after hours. You can do them at your own pace in many circumstances. And then finally, as we're looking at students who maybe are making decisions about next fall, what they want to do. I want to highlight College Credit Plus and the value that this is creating for families in the state. Back in 2015 and 16, there were only 54,000 students who took advantage of College Credit Plus. Now it's 76,973 students. They've earned a total in the previous year of 645,075 college credits. That is equivalent to $165 million in free tuition, essentially, that they earn, because this is at no cost for a high school student. It's working out very well for the families that are using this. I want to add that there are 2,666 high school students who've earned associate's degrees while they're still in high school. So that gives them a head start. I've met many of these young men and women. They're earning college credits. They're earning industry credentials. They're work ready when they leave high school, but also prepared to go to college too, if that's what they want to do. So these are all the resources that we are making available. And every one of these that I've talked about today is at no cost to the user. We're helping people who are working get upskilled so they can get better jobs and have more earning power, and employers have the talent they need. With IMAP, you can be out of a job today, earning those credentials, and then moving into a higher paying job tomorrow. And with College Credit Plus, that's your way to an affordable college degree, free college while you're still in high school. So Governor, I'll turn it back to you. Great news on the economic front. We continue to build momentum. We're with great employers, state-of-the-art technology, and a lot of high-paying jobs that we're training people to take to build that goal and vision that we had to give everybody the opportunity to live their version of the American dream. And we're moving forward in Ohio. Thanks, Governor.
All right, we're ready for questions.
Governor, first question today is from Mike Livingston at Gongor News Service.
Hey there, Governor.
Mike.
Some lawmakers who have voiced disapproval about vax-a-million say they think there's some other factors driving up the vaccination rate. I guess what do you make of that suggestion? Do you think there are other factors at play as you're trying to gauge the effectiveness of this lottery? Thanks.
Well, look, all I know is that before we announced it, we were going down, and we'd been going down. We hit, a rough spot in the road, so to speak, basically about the time that we saw Johnson & Johnson pull back. That coincided, at least as far as I could see, that coincided with the approximately point in time where we started having more supply than demand. And a lot of people had already been vaccinated. So it was starting to go down. And as we looked at this, we knew that for us to really get out of this pandemic and to move forward, we needed to have more people vaccinated. And we made the decision to try this and see what it would do. I'm more than happy, very, very happy with the results. And the results, you've seen it, the numbers go up. I gave you the 10 counties where we've seen the highest, but it's basically up pretty much everywhere, all demographics. It's up among African Americans, it's among white, it's virtually all age, all groups, it is up. So, the results are there. Now, will it continue to go up? Will it continue to be high? I have no idea. But this was just so important to our future as a state, our immediate future and our long-term future. Having more people vaccinated really allows us to get back to normal. And if someone is not vaccinated today, it is still a very dangerous time for that person. And even though we're coming back, and even though more and more people are getting vaccinated, what we don't want to be is in a situation where we just continue to see deaths and we continue to see cases, maybe to a lower number, hospitalizations lower, but we still have, as you can see, 700 people, Ohioans, who are in the hospital because of COVID. So this is still serious. I'm optimistic about our future, but really so much depends on vaccinations, how many of us get vaccinated. It's also important when we get vaccinated. As Fran and I traveled around and talked to people around the state and tried to understand, why are you being vaccinated today? How come you decided to do it today? And we've had great discussions, and mostly us listening to them. It's just clear that there's this middle group of people who are not gung-ho to do it, not gung-ho against it. They might get vaccinated. They may eventually get vaccinated. But just we're in no real great urgency to do that. And by moving them up and by not only getting more people vaccinated, but by moving someone up to get vaccinated today versus 3 weeks from now or 6 weeks from now, we know that has an impact because that person no longer can get it, no longer can pass it. And so the faster we can do these things, the better off we are.
Next question is from Tom Jackson at the Sandusky Register.
Hey, Tom.
Hi, Governor. I just wondered if after the apparent success of the lottery effort, are there any other incentives that you're looking at down the road, or is that kind of be it as far as incentives go?
You're breaking up. I just didn't get it. I'm sorry. You want to try that again, Tom?
Governor, a summary of his questions was after the success of vax-a-million, would there be any other incentives that you would think of including moving forward, or would this be the end of incentives?
No, Tom, I don't think we know. I mean, look, we make, throughout this period of the virus, we make decisions based on the best available information we have at the time. And so we'll just kind of see how this is moving. And, no decisions have been made what we do in the future. We've outlined that we're going to do this 5 times, so people can be assured that when they sign up, when they get vaccinated, they sign up. They're going to, have after Wednesday there'll be four more opportunities to get a scholarship and 4 more opportunities to get $1 million. So I think that's about all I can say at this point.
Next question is from Jake Zuckerman at the Ohio Capitol Journal.
Hey, Governor. Last year, within about a month of George Floyd's death, you unrolled a police reform package. It was centered on use of force, body cameras, chokeholds, recruitment, training, and some other provisions. Didn't go anywhere in the legislature. So I'm wondering, what went wrong last year, and do you expect a different result this legislative session?
Well, I think we will get a pass this year. I think that, a lot of work has been done on this bill by members of the legislature. A lot of work's been done on this bill by our administration. It's a bill that is sound. It will really, I think, put Ohio at the forefront of reform in this area. These are things that I think can be supported, are being supported by police. They're being supported by civil rights groups. They're being supported by community leaders. So I'm optimistic about this bill. Former Sheriff Phil Plummer from Dayton area is one of the main sponsors of this bill. He's worked very hard on the bill. So I'm optimistic about getting it passed.
Next question is from Alex Ebert at Bloomberg.
Good afternoon, Governor. The Peloton announcement today also comes with an estimated performance-based tax credit of about $50 million for 15 years. Can you tell me how your administration looks at that sort of credit in light of difficulties, enforcing these things in Lordstown? And can you also talk about whether or not Georgia and North Carolina were offering cash nearly that amount? Thank you so much.
Yeah, I can't tell you that we can get you that last part of the question. Look, I mean, we make calculations, we make decisions based upon jobs that we feel will be created, the quality of the jobs, how long those jobs will last. And, we know that, we are competing against other states. And so we obviously take that into consideration. We don't play in every game necessarily, or, we may make an offer in every one, but we have to make a determination every single time about what kind of incentives that we want to put out there, what kind of package that we want to put out there. So it's made on a case-by-case basis. It involves Jobs Ohio. It also involves our development office. And again, it's a case-by-case decision.
Next question is from Andy Chell at Ohio Public Radio and Television.
Hey, Governor.
Andy.
With the practices that you mentioned earlier when it comes to children who might be exposed to a positive COVID-19 case, what kind of legal authority do local health departments have in that area going forward after June 2nd? And do you believe that SB 22, the bill that was recently passed by the General Assembly, might have any effect on that authority?
Well, as I recall, the bill says that if there's evidence of exposure, direct exposure, the health department, can do what they need to do. I think the distinctions the legislature made that I contested, but was whether there is direct evidence of direct exposure. And my understanding, that most of these cases that the superintendents would be talking about, most of these cases that the health departments were talking about with me this morning, you would have that. So I don't think this would be in any way against the, what at least is what is in that law as passed by the General Assembly.
Next question is from Jeff Reddick at WSYX in Columbus.
Hi, Governor.
Hey, Jeff.
Mass shootings in Ohio, including the one in Columbus again, and it seems like it's still strong. Ohio doesn't, move quickly through the legislature. The Democrats in the State House began a gun violence prevention caucus with their first meeting this morning. A lot of their bills don't seem to move quickly through the State House. So what's being done, what can be done, and how much onus is on the public ourselves to stop this spate of violence that continues since last year?
Quite a conversation, Mayor Tito, and Youngstown as well. We've talked with, over the years, I've talked with many mayors about violence in their communities. And what you find in many, many, many cases is it's the same people who are committing the violence time after time after time. So I don't care what the legislature calls it, but the framework is there. Not just the framework, but the bill is there in front of the legislature to go after repeat violent offenders and get them out of our communities. They're killing people. They're killing innocent people. And it's happening every single week. So again, I'm confident that the legislature will look at this bill and will pass it this year. This is, you know, when you get repeat violent offenders and they're found with a gun, that person should go away for a long time because they've been told time and time and time again when they were put on, when they were sentenced, when they got out, they were told, you cannot own a gun. And so if these repeat violent offenders are found in possession of a gun, we should be able to throw the book at them and get them out of our communities. And so the bill we present to the legislature would do that. And it will give judges the authority, it will give judges the discretion based upon the facts of that case to be able to do that. So I just hope the General Assembly, I trust the General Assembly will look at this again because this bill will save lives. There's absolutely no doubt about it.
Next question is from John Bedell at WHIO in Dayton.
Hey, John.
Hi, Governor. So I talked to a Miami Valley state lawmaker today, Representative Jenna Powell from Arcanum. She told me this morning she's planning on formally introducing her bill this week that would ban state vaccine lotteries. She told me today that vax-a-million is, quote, a gross misuse of taxpayer dollars. So first, what do you say to that? And secondly, if this bill were to make it through the legislature and to your desk, would you veto it?
Well, I respectfully disagree with her. You know, she certainly is entitled to her opinions. But I think the facts show that once we put this in place, there's been a lot more excitement about vaccines, and we've seen vaccines go up. And so that will save lives. That will help get us back moving forward at a faster rate. It's just the right thing to do. We have one weapon at this point to fight this vaccine. Health orders are going off. People are tired. They don't want to wear a mask anymore. And I don't blame them. And they say, look, we now have a way out of this. And so when someone becomes vaccinated, they cannot pass it. They can't get it. So the more people we have every single day who get vaccinated, it's better for the rest of us, not just for them. You know, they put a cloak of protection around themselves, but they also help slow it down. And so the more people, we're up to about 44% or so of the total population. We're continuing to move up. These people cannot get it and they cannot pass it. And the more people that can't pass it, the faster this devil goes away, the faster it goes down. And so that is why spending $5 million, $6 million to do this is money very, very well spent. There was an article, someone estimated the cost for someone who is in the hospital who has a bad case of COVID, is there for a while, could be $250,000, could even be more. So, you know, preventing people from getting it, preventing people from going to a hospital saves lives, saves money. It's the right thing to do. And for me, you know, not to use any tool that we could use to drive these vaccinations up and to drive the virus down, it seems to me would be irresponsible. We didn't know how well it would work, frankly. You know, we were taking a chance. We felt it was a calculated chance. We felt it would work, and it has worked. So this is why we did what we did, and yeah, I certainly hope that bill will not have any chance in the legislature.
Would you veto such a bill?
Well, sure. I mean, sure.
Next question is from Josh Roldenberg at Spectrum News.
Yeah, Governor, just to piggyback off what you just said, I mean, you've seen some significant increases here amongst younger people, and then obviously the 20 to 49 range. You said you didn't really know what to expect, but if you had any expectations, has it exceeded it so far, or is this about what you thought you'd see?
Yeah, the vaccinations that we've received after we announced vax-a-million have exceeded my wildest expectations. I can't tell you how happy I am about it. And, you know, it's been a marked change, a noticeable change. We really turned around from going down and to brought us where we're starting back up. And we have already, you know, every time someone gets vaccinated, it's like money in the bank. We have already achieved so much from the vax-a-million. I mean, you know, if we got not one extra one beyond today, and that's not going to be what happens, but it certainly would have been worth it. But we hope that this interest in it will continue, and I think it will with $1 million coming up every single Wednesday. You know, I think people will continue to be vaccinated. And look, what we found was when Fran and I went around and listened to people, and we continue to do it this weekend. I was in Children's Hospital, in Dayton's Children's Hospital in Cincinnati, and there are just people who don't feel strongly about this one way or the other, and they may eventually get it. And if we can help them make that decision earlier, it's going to be very helpful to us. So yes, I'm very pleased with what we've seen so far.
Next question is from Bennett Wise at WKEF in Dayton.
Hi, Governor DeWine. There was a report today from CNN that 25 states in the District of Columbia reached 50% of eligible residents fully vaccinated. Some states have larger populations than Ohio. So do you think the announcement of no masks for fully vaccinated people was misinterpreted and more people won't get vaccinated because they think everything is back to normal?
Well, I think it's always a challenge. And I think, you know, I have a responsibility to speak as bluntly as I can. I've tried to do this for 15 months. This epidemic is not over with. And I don't know how many times I've said this, but there's just a fundamental difference between someone who is vaccinated and someone who is not vaccinated. If you're vaccinated, you know, you're pretty much, you can go live your life. And people are so excited to get their life back and so excited to see their grandkids and go visit their grandmother and go to a ball game or go to all the different things that people want to do. If you're not vaccinated, you know, I think we have an obligation to continue to say, if you're not vaccinated, you know, you still run a very significant risk because the virus is still out there. It has not gone away. We're headed in the right direction, but it has not gone away. And my concern is that while things will look good, that silently sometimes, and maybe doesn't make a lot of media, you know, you're going to continue to see people die. And these are people who do not have to die. They do not have to die because we have the vaccine. And so that is what, you know, bothers me. It should bother every Ohioan. It's why I'm doing everything in my power to get the medical community, you know, to take the information that they give us, to get that information out. And that is, if you're unvaccinated, the danger is still very, very much here.
Next question is from Laura Bischoff at Gannett, Ohio.
Hi, Governor. There's a number of bills that are pending in the General Assembly to weaken Ohio's vaccine requirements, giving people more choices and more privacy. Given that we're now coming out of this global pandemic, would you veto bills that would eliminate mandates, eliminate vaccine registries, in general, weaken vaccine requirements? And do you support removing the reasons of conscience exemption for K-12 students?
Look, you know, we already have a law. It seems to be working. You know, I would have to look at any law that's been proposed or bill that's been proposed and take a look at that and see what it says. So, you know, that's always what I do. The legislature writes the laws, and you know, then we weigh in at some point. A lot of bills get introduced, and as far as those bills, Laura, I've not really looked at them. So don't have an answer at this point. We'll see what comes up. But I think, what is working, what has worked, and what we've lived with in Ohio, as far as the exemptions, as far as people's ability to exempt out of things, it seems to have worked pretty well. So we'll see.
Is that what schools are telling you? Because the exemptions, the reasons of conscience exemption allows parents to get out of vaccinating their kids for K-12 for pretty much any reason. Are schools telling you that that's working okay? Because there's a lot of school districts that have low vaccination rates, or their vaccination records are kind of a mess.
Okay, Laura, we'll take one bill at a time, and I'll make decisions when these bills come to me. So, but there's a lot of bills out there. I think part of the legislative process, as you know, what makes the legislative process work so well is that there are hearings. Interested people, whether they're school officials or whether they're health officials or whether they're parents, they have the opportunity to come in and testify. So we should let whatever bill has been introduced, if there's a process for it and we hold hearings, that certainly should take place. But I'm not going to prejudge these bills at this point.
Next question is from John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor. Acknowledging the numbers that you've given and the success of vax-a-million that you've talked about, within the health community, there are medical professionals who believe when a monetary value is attached to a health benefit, that long-term it serves to undermine that benefit. And I can't help but wonder, is that something that you discussed and considered in deciding whether to try this vax-a-million idea?
Yeah, you said in the long term, it does what? Undermines what, John?
Undermines the health benefit, especially when it's a vaccine designed to save lives, when you attach a monetary value.
Look, I just don't believe that. I disagree with that, with all due respect to them. We have seen hospitals that have attached incentives for their own employees. Cleveland Clinic, for example, has been extremely successful, but other hospitals have as well. If their employee meets certain metrics, does certain things, then they are economically rewarded. And they can tell you that at some level, here's how much money it's going to take to really move the numbers. And they have a bunch of experience in that. So that is a whole area of economics. It's a whole area of study. But many, many times, that is, for that employee, it is direct money in their pocket. And so, look, we're going to, under the law, and following the law, we're going to do what we need to do to encourage people to be vaccinated. Understanding, though, and respecting that there are people in Ohio who do not want to be vaccinated. And we respect that right. And, no one should force them to be vaccinated. I've said, John, all along that we really are focused on those individuals who are sort of in the middle and they just have not made up their mind that they're going to get it, or in their mind, as many of them told us, I thought I was going to get it sometime, but, just hadn't got around to it. And moving that date up for those individuals has great benefit for them, and it also has great benefit for the rest of us. And that's what we've been trying to do.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. My question is, looking forward to the next week and a half, we have the health orders lifting, and we also have a holiday weekend coming up. These are things that previously we were obviously concerned about when it came to the spread of the coronavirus and our numbers. Are you worried that with our vaccine rates remaining below 50%, that these two things could trigger a wave of cases?
Well, we have something going for us, and that is a lot of people vaccinated. And that's why we're trying to get more people vaccinated. But, for those, we really live in a world of two Ohio's today. We have the people who are vaccinated and they're safe. We have the people who are not vaccinated and they're not very safe. And they're very much at risk. So, if the same person, or if you have two people go to a picnic, or let's say go to an event inside, and it's crowded, let's just say it's a bar and two people go, one's vaccinated, one's not vaccinated, fundamentally different risk. One has great risk, one has little, if any, risk. And I don't know how to explain it any other way. So yes, I'm concerned for Ohioans who have not been vaccinated.
Next question is from Scott Hallis of the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor, how are you?
Good, sir.
Good. Hoping you can clarify something for me. I've gotten a few calls and a couple emails regarding the vax-a-million. If we're not mistaken, someone is eligible after they've had one dose of the vaccine. Is that correct? And
yes.
If their name is drawn, is there any requirement for them to get the second vaccine, the second dose, before they would be able to collect? I think there's some people who are maybe confused about that.
No, look, we would encourage people to get, unless they're getting Johnson & Johnson, which is one shot and done. If they're getting Moderna, they're getting Pfizer, we would obviously, encourage them to get the second shot. But no, we're not going to require them. We're not requiring anybody to get a shot, first or second. So we're not going to do that, and we're not going to hold anything over their head. You get significant immunity the first shot, but it's much better if you get the second shot. But the reason we did that, and the reason we didn't say you got to have a second shot, I wanted to get as many people in as quickly as they could. So let them be eligible. So they would know if I got this first shot today, I'm eligible right now. We did not want to have a gap of 3 weeks or 4 weeks, and we want to encourage everyone to get that first shot. So that's why we did it. And so no penalty. If you win, you win. You get your money or you get your scholarship.
Governor, next question is the last question for today, and it belongs to Dan DeRose of WOIO in Cleveland.
Hey,
Dan. Good afternoon, Governor. How are you, sir?
I'm well, sir.
Hey, I know this is hindsight. Obviously, it's going to be $1 million. You somewhere in there had a conversation, but I've heard from a lot of people, and I did a Facebook post. Why not make it $10,000, $100,000 prices, or $20,000, $50,000 prices, or even $40,000, $25,000 prizes? That gets a lot more people interested, instead of just saying, well, my odds are still 1 out of 2.7 million people. But when I find out 40 people are going to win a week, wouldn't that have generated a little bit more peak of interest?
Dan, I don't know. The truth is, it might have, it might not have. I just don't know. This is what we went with. We're obviously the first state to do this, and I know we're watching what some other states are doing. We got a few other ones are doing, and they're all doing kind of different things. So I think the main thing was to create an excitement, anticipation, give an incentive for people to, move up the date where they're going to get vaccinated, or decide, this was kind of the thing that put them over and decided to get vaccinated. We're very, very happy, when we're seeing what's going on, 16, 17-year-olds, and that's a good thing. So it's worked. Could it have worked better if we'd done it differently? I don't know. And, it's going to be interesting to see what some of these other states do and what kind of results that they have. But we're going to continue to assess this as we move forward, and again, make decisions based upon what we know at the time. That's something we've done for 15 months. It's not always perfect. We don't always get it right, but we try to take the best information that we have and then make those decisions. So thus far, it's worked. So I want to thank everybody, and hope everybody has a good day.
Recording stopped.